Good evening. I'd like to call to order the meeting for the Caldwell County Department of Social Services. We're here in the Out and East Starnes building. It's just a little after 5 o'clock, and we'll get started with the Pledge of Allegiance. And then following that will be our invocation by Pastor Darrell Hatchell with Temple Hill Baptist Church in Granite Falls. Everyone face the flag. Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Pastor, if you'd like to come up to our podium here and speak your microphone. Thank you for joining us this evening.
Thank you for having me. I appreciate it. Let's pray. Father, we thank you for this day and for the many blessings of life that we have obtained, Lord, from your hand. We realize that anything and everything that, Lord, we have and we have experienced in life has come by way of your mercy and your grace, and we're appreciative of that tonight. Thank you that, Lord, in days like these, that, Lord, we're able to stand publicly and pray and call upon your name unashamedly, without fear. We see changing times and tides around us tonight, but for this time, we're able to stand publicly, Lord, and declare that, Lord, we have a need, Lord, that is without, outside of who we are, and, Lord, outside of our own strength and wisdom. We need your help tonight. It's good to see in God we trust on our buildings and on our walls. And, Lord, tonight, truly we must, Lord, have trust in you. Too many tonight have the mindset, Lord, that it's just Lord, it's something to say, but, Lord, it's not a true intent of the heart. And I pray tonight, God, that, Lord, we would look to you for our every need. These folks, I realize, have gathered together. Lord, they've had a busy day and a busy week, and they're here, Lord, to have a meeting to deal with responsibilities that, Lord, lay before them. And I pray that, God, you might give them wisdom. The Bible says that, Lord, if any man lack wisdom, let him ask of God, who giveth liberally and upbraideth not. And I'm glad tonight that, Lord, if we'll ask you, you will lead us, guide us, and direct us. So I pray for them. Give them instruction, give them wisdom, give them understanding. Help their decisions tonight to be made easy. I realize, God, we live in a broken world. God, broken lives, broken homes, broken promises, broken dreams all around us. And, Lord, you've given us the responsibility, God, in times like these to make decisions that can help someone and influence someone, God, in a positive manner. And I pray for them tonight. Touch their homes, touch their families, touch their lives. They'll leave this place tonight and they'll go back home, Lord, to their own personal problems. I understand that. And, Lord, they're here tonight and, Lord, in their job and their responsibility, God, to take care of the needs of other people. And I pray that you would help them, undergird them, and strengthen them tonight. Father, everything that is accomplished, everything that is done, we want to give you the praise and the honor and the glory for it. And we pray tonight in the name of the Lord Jesus Christ. Amen.
Amen. Thank you, sir. All right. We'll get onto our agenda. Is there any amendments to our agenda? No amendments. I need an approval to approve the agenda as it is. Need a motion to approve the agenda as it is.
I make a motion.
Have a motion, need a second. Have a motion and a second. All in favor, please say aye.
Aye.
All opposed, motion carries. Now need a motion to approve the minutes from the last meeting.
Motion.
I'll second.
Have a motion and a second. All in favor, please say aye.
Aye.
All opposed, motion carries. All right. On our first item on our agenda is going to be item for discussion is a 2024-2025 budget proposal. Kim Arnett, Director, and Chris Conley, Business Manager.
So our budget proposal is essentially what we all have met about and gone over. I'll remind you there are a couple areas that we have seen an increase, and we'll talk about that just briefly. And of course, if there are any questions that I can't answer, of course, Chris will always be able to answer those. So we know there was an increase in our administration, Department 5310. The 90% of that increase was related to, or is related to, our merit increases for staff. And then if you remember, over the past fiscal year, we've added some positions. So we started the fiscal year at a certain budget, and then throughout the year, we've had positions approved and added to our budget. And so those are already currently in the budget. We had our Restart position, which we share with Restart. We had our IT position, which we also share with county IT. And so those two positions were added jointly with other departments to help us with collaboration and work between our departments. And so you also remember our Medicaid expansion. So we had 10
How could we
positions.
forget that?
How could you forget Medicaid expansion? We only talked about it for 2 years, it seems like. So we had 10 positions added, which were completely funded, at no cost to the county. And so those were our new positions added throughout the fiscal year. As you remember, when we spoke over the past month, we are wanting to add more of Medicaid expansion positions. We're still looking at caseloads around 1,100 right now. We're expecting to increase those caseloads because people are continuing to apply and be approved for expansion. And so in order to get caseloads back to what's manageable, we're looking at adding 6 more expansion positions. With the increased funding, we are looking at still 0 county dollars for those positions, with additional money left over, even after those positions. Do you want to say anything about that?
Well, I would mention our expansion funding that we will receive is increasing 88,000 from this year's amount to next year. So that will more than cover the 6 additional positions. The county cost on those is only about 12 or 13,000 per position because they're reimbursed at about 75%. So it's only a 25% county participation that will be covered by the expansion dollars.
Yeah. So it's cost neutral to the county to add those positions. The one position that will require some county contribution is our social work supervisor position that we are requesting, and that is the on-call position that we spoke about. And so we're looking at around $36,000 for county participation in that position. We're reimbursed, around 50% for that position. So those are the positions. I know we talked through that. If you have any questions about those, I'll be glad to answer those.
Social workers out here in the crowd, y'all okay with that supervisor's position? Just want to make sure.
Especially you might want to ask the social work supervisors out there.
Okay, social work supervisors, y'all okay with this new position? Okay, just checking.
Yeah. So if you have any questions about any of those positions, I'll be glad to try to answer those. Okay. And then we did have somewhat of an increase in our travel and training budget. So you saw some differences in that. There's multiple reasons for that. We have really beefed up our training. We have sent several people to LAMA. I think 4 of our staff are in that training. Also, our child welfare training from the state, the pre-service training that they have to have before they do any casework, is extending from a 3-week training to a 7-week training. So we're looking at travel and training expenses around that one particularly. Is there anything you would like to say about that particular increase?
No. Well, that increase will be reimbursed 50-some%. So, we're requesting $24,000 more dollars, but with about a 50-some% reimbursement attached to it. So the county dollar increase is only about 11,000, that is.
Yeah. And so we talked about a couple different areas, and if you guys want to have any questions about what we've spoke about before and what I just mentioned, then I'll be happy to answer those.
Any questions?
No.
Okay.
Anybody got any questions?
So we'll just need a
I have one
decision.
question. before we go, and this, I think this is kind of in the budgetary question, right? Budgetary world. If not, we can make a motion, move on, and I can talk about it after fact. But I know there's been some chatter around Article 44. Without going into extreme detail, I don't know if the other board members really know about Article 44, what it is and how it could impact us. Could you give us a 30,000-foot view of Article 44 and how that might impact our budget?
It will have no impact on the DSS budget.
Okay.
Could have an impact at the county level. Article 44 relates to sales tax dollars that the state uses to pay for Medicaid services received by clients. Those costs don't run through the DSS budget. And so, yeah, while that's going to impact a number of counties in the state, it doesn't.
It's not, so that money does not flow through DSS,
Correct.
even though
Correct.
it says Medicaid in the,
Yes.
yeah.
Yes,
okay.
it's for Medicaid services. The only Medicaid funding running through DSS is for the administration of the program,
Got it.
determining eligibility. Those dollars are paying for services, and again, it's outside of the DSS budget.
Fantastic. I
Yes.
just want to make sure that everybody understood that, because there's been a lot of chatter around that.
Yeah,
In
there
case
will
you might have
not,
heard some
I had not
rumblings
heard about
going on.
there will not be any effect on our budget, and that is, again, on the DSS budget. On county level, the revenue will decrease.
Yeah, and Article 44 is a little complicated, so it is having to do with sales tax and how that's calculated and stuff, so.
Yeah,
All right, there's a potential impact of about 1.6 million to the county budget if the state doesn't figure out exactly how to fix it.
right,
So,
yeah.
all right, anybody got any more questions? With that, I'll entertain a motion to approve the 2024-25 budget proposal.
I'll make a motion to approve the 2024-25 budget proposal.
A second.
Have a motion to second. All in favor, please say aye. Aye. All opposed. Motion carries. All right. Hello. No worries. Next on the agenda is going to be reports. Supervisor's going to come up and talk to us a little bit about Social Worker Appreciation Month. Ms. Crystal Henderson, Staff Development Supervisor.
Good evening.
Good evening.
So as you know, March is the annual campaign to kind of recognize social workers nationwide. And we try to do that at Caldwell County as well. And so it really is just a time for us just to honor kind of these unsung heroes in our community. You know, these folks at our agency that work tirelessly to uplift and protect the most vulnerable in our community. And the theme this year is empowering social workers. And this is straight from the National Association of Social Workers website, but it says this theme represents the need for our community to support social workers so they can continue to do the life-affirming work they do and help address the needs of our community. Social workers, in turn, empower people and our communities, helping everyone they encounter to achieve their full potential. Social work is definitely one of the fastest growing fields. The labor statistics from the Labor and Bureau field say that, you know, we're going to have a 7% increase in social work, the needed social workers within the next 10 years. And while this is a fast-growing career, you know, a lot of states, a lot of counties, and ours has been pretty fortunate, but a lot of areas have shortages in social work staff. And we've seen that some through the years, but we're really, really very fortunate. And social workers not just work for DSS, but they work in all aspects of our community. Schools, hospitals, military, mental health centers, and last but not least, DSS. You know, these guys, they're on the front lines helping the community solve these pressing social problems, such as we've seen such a demand for increased mental health, the addiction crisis. Social workers face these challenges when working with individuals and families. And the cases that we've worked in over my 12, 15 years in social work, they're coming much more challenging. We're dealing with a lot of things such as homelessness, drug and alcohol addiction, mental illness, domestic violence, physical and sexual abuse. And one of our biggest challenges is finding appropriate placements for resources for not only children in DSS custody, but other vulnerable populations such as elderly and disabled. These are just a few of the things that these social workers tackle every day. Within our community particularly, you know, we had a homeless shelter shut down in the past couple years. Homelessness is on the rise. The opioid addiction crisis has hit this community hard and impacts every one of us, no matter our race, region, or our economic status. We all have been affected by the opioid crisis. We can't stress how the work these folks do is more important now than it ever has been. These social workers are exceptionally qualified to handle these problems, doing delicate work of meeting people where they are to help them achieve their goals. Child welfare social workers serve some of the most vulnerable individuals in our community. They specialize in building on the strengths of families to help them provide safe, nurturing homes for children. Adult Protective Services social workers link older and disabled adults with services that help them live independently and with dignity to maximize their quality of life and participation in society. It's rare that social workers get recognition, and the times they do, it's usually when the system fails, something bad happens, and we end up on the news. We get called names all the time: baby snatchers, the devil's secret service. And our social workers do a lot of work that goes unnoticed. In the past year, these guys have done so much that has empowered the people in the community that you guys don't usually hear about, and so I want to highlight some of those today. We had one child this year that the social worker coordinated with the Children's Hospice, Mission Hospital, the Child Medical Evaluation Program, more than 40 medical providers, including hospitals and specialty physicians in more than 6 states, to conclude that a parent was inflicting medical child abuse, also known as Munchausen's by proxy, on her disabled child, a child that we initially thought had a short life expectancy and was in hospice care. That child's now doing very well. We had one family that a social worker took time away from her own family to drive this woman and her child 5 hours across the state so that she could go into a rehab facility. We had 2 brand new social workers this year that saved somebody's life. We had a very quick 1-hour training on substance abuse and how to notice impairment working with someone. They went to court the very next day and saw someone on the sidewalk that they thought seemed impaired. And through watching this person's motions, this person passed out into the street. They not only stayed there with him and made sure that he was not harmed, but one of them ran to the courthouse to get a deputy, and that person was administered Narcan and survived. There are times that we not only have to go out when a child dies or when a parent dies, but we then go pick up that child to take them to their parent's funeral. We had a case this year that was a pretty significant sex abuse case. And not only did we work with these kids to protect them, to keep them safe from this, but when they needed to testify in court, the social worker spent time with these kids in the community with the DA, working with them at the library, at coffee shops, so that they could form that relationship and feel more comfortable when they did have to go testify. We've recently seen the opioid crisis affect the kids in our community too. We've had several cases where there's 15 and 16-year-old kids who have significant addiction issues, and our social workers work with those families to help get those services in place. This year, we have one child that's in custody that a social worker sent 75 letters out in an attempt to identify a family for this child. We have one child who has been in care for 3,094 days and in 28 different placements. But through networking, collaborating, and developing relationships, when this child had to be moved from his last placement, he had such a relationship with the data manager at his school, who was also a licensed foster parent, that she told the social worker she wanted to take him home for the weekend so that he didn't have to sleep in a DSS office. That data manager now plans to adopt that child. Most people want to go home at 5 o'clock, but most jobs do end at 5. Or if they don't go home at 5, a lot of folks don't work weekends. But the needs of the vulnerable in our community doesn't stop just because it's 5 o'clock. We have adult protective services workers who came in one weekend and changed adult diapers on a bedridden client when no one was there to help. They also had a client that within the span of 2 years, they received 4 reports. During the first 3 reports that they received on this individual, they tried implementing services to educate the family to keep this person safe in their own home. They coordinated with doctors, with therapists. They provided transportation to help alleviate the neglect that this person was enduring. But during the fourth report, the department confirmed that this person was being abused by her caretaker, and the department ended up becoming the guardian of this person. Now this person is enrolled in a program where they get to do crafts, have friends, and go on outings. One outing, they went swimming, and the social worker helped this person find a bathing suit. During that encounter, they learned this person's never had a bathing suit. They've never been swimming. This person had never had their hair done in a salon and now has a standing appointment to get her hair cut, styled, and colored. They were able to identify a support person who takes this person on outings, including Dollywood. Every year, Adult Protective Services and Child Protective Services work together doing Angel Tree and Christmas Cheer to make sure that these vulnerable people in our community get Christmas gifts. But as much as good, social work is heartbreaking. Removing a child's never easy. Doesn't matter how bad the situation is, there's always that need for child safety. In separating siblings, when families can't keep children safe, there's nothing that feels much worse than that. These vulnerable adults sometimes need us to intervene and take guardianship. Could you imagine being an adult and thinking there's not even one person that's willing or able to care for you? I know how I felt the first time I realized that sometimes bad things happen to good people. Children are abused and mistreated by people they trust and love the most. There are times that we all question humanity and unfair systems. We tell children that their parents do love them even though they can't live with them right now. We walk alongside the parents who have done terrible things to their children because reunification is the ultimate goal. And we're honest with these parents and tell them sometimes that doesn't happen. Social workers see and deal with things that no other normal profession does. We recently had gang and drug training, and when one of my folks said they went home and told their family said, "What kind of a job do you have that you need gang and drug training?" We learn a lot of terminology. This past year, I learned what throuple meant. We've heard of booty bumping. We see firsthand how the opioid crisis not only affects the adults in our community, but also the kids. We hear firsthand disclosures of physical and sexual abuse. We not only hear those, but we witness situations that both a father and a stepfather sexually abuse the same child. Throughout this fast-paced career, we grow and we learn a whole lot about ourselves too. There's times we get angry with people. We get sad with people. We get frustrated with people, and sometimes we get happy with people. And a lot of times that's all in the same day. But we do get glimpses of hope, love, appreciation. We learn people can change, and people don't want this life of hurt. Sometimes they just need help. Our social workers not only take on this heavy task, but they have to learn so many things. There's so many agency, federal, and state policies. And they're also, not only do they have to know all these laws and regulations, but they're expected to be experts about domestic violence, substance use, mental health, child development. We help families navigate insurance systems so they can get the treatment they need and look for other options or free funding when that doesn't work out. I've always said if you are looking for something cheap or free, ask a social worker because they can usually find it. In this agency, we're very, very fortunate. We have a lot of great workers, but over half of our workers have less than 2 years' experience. We all have days that we question if it's worth it. Why do I want to subject myself to being cursed by a family or criticized by a society when all I really want to do is help somebody? Why would I want to work long hours, answer calls in the middle of the nights about infants with broken bones or children that were raped by a parent, putting our own family on hold to help those that really don't want us there? But at the end of the day, the positive times and successes, the times a parent reunifies with their child, or the times that we receive calls or messages years later about a family's success, the times that we get to see a 42-year-old shine because they got to go swimming for the first time or get their hair done in a salon, those make up for all the bad that's happened. The theme this year is empowering social workers, and to all of you social workers that are here today, I want to share this letter with you that's written by Vicki Shevlin. She is a very seasoned social worker that does a lot of training throughout Europe now, but she wrote this letter and said if I could tell my newly qualified self anything, this is what I would tell you. I'll start with this. You will be okay. You won't always feel this overwhelmed and scared. You are going to learn a lot, so much it will take years to soak in. You are going to be challenged. Things you believe to be simple will become complex. You are going to cry. You will cry when you are angry at unfair systems. You will cry when you argue with your manager about oppressive decisions. You will cry when you see families falling apart, and you will feel helpless when you can't do enough to support change. You will rock a 2-year-old to sleep in a police station and wonder whether you have made a mistake, whether this is the job for you. You will advocate fiercely for parents and their children. They won't see all the work you do in the background, and they will think you don't care. You will learn to let go of what you can't control, but it will take some time. You will treasure the moments you spend with children and families. You will hold on to cards, drawings, and friendship bracelets given to you as thank yous. You will learn that the success of social work is in the small moments, the moments that can't be measured or recorded, the time in which you see people grow and make change. You will hold on to these moments on the hard days. And there will be many hard days. Days when you decide you're quitting. Days when you question what's the point. On those days, your colleagues will lift you up and make you laugh, and one day you will help new social workers who have the same doubts you do. My advice to you now, you're not an expert. I know you think you're clever using all those fancy words, but you don't know as much as you think you do. People with lived experience will teach you more than any book or course ever will. Don't be so hard on yourself. Perfect doesn't exist, and it never will. Keep being kind to people. Even when you are accused of being too lenient, everyone deserves kindness, and you know this deep down. Stick with it. There will be many ups and downs, but you will never be able to do anything else with the same passion and care that you have for this career. And take your bloody lunch breaks. Vicki.
I just want to add to, I'm so glad to see so many of y'all here tonight. I was hoping we would have several of you so that we could just say, as Crystal was reading through all of that, it's not been that long ago that I was in the field, and I think, we do all that, right? I mean, there are those days where you're feeling those emotions just all over the place. You start the day with, this is going to be a good day, and then something terrible happens, and then something a little bit better, and then something even worse, and you just think that you just can't do it anymore, but somehow you just keep getting up, and you keep coming to work, and you keep helping others and giving of yourself just selflessly. And I think that's what stands out to me most about our social workers, and not just our social workers, but all of the people in our agency that help each other and help others day to day, is that selflessness. And the pastor said earlier that we all have a great responsibility, and we do. When you think about it, we as an agency have such a great responsibility to our community, to each other, to ourselves, and we do that each day by day. And I'm just so proud to lead an agency that has such great folks working for our community and working with one another, and to see the growth in all of you. And it's an honor. And so I just want to say, with my heartfelt thanks to all of you for everything that you do.
So if you're a social worker, would you please stand up? If the folks behind the camera here could scan around and get a good shot of these folks, we'd appreciate it. Can we get a picture of, can we swing the camera around? There we go. Smile, you're getting ready to be on candid camera.
You're almost there.
Almost there.
It's coming.
There we go. There we go. So I would, again, let's give these folks a round of applause. I will say that, some people have heard me say this before, but before coming on to the DSS board, I have no clue. I didn't even know that a social worker existed. Kind of heard the terminology, but didn't really know what they did or what they stood for. And we look back and we talk about, we always talk about the heroes. When you identify our society if you ask somebody, well, who do you think a hero is? The first thing they're going to talk about is a policeman, a fireman, a paramedic. And over the last several years, I've added 2 more professions to that list. One of them is school teachers. Think about what society would be if we didn't have those 4. And after coming on DSS board, I've added 1 more. That's a social worker. It's amazing to see what you guys are able to accomplish. And we talk about heroes. We talk about the different things that people do in government. You think about a government agency, right? So we all know that there's places you could go and you can make a lot more money than working for a government agency. But you're not here for the money. You're here to do what you do, and that's to help others. To be there when somebody else is in need and you're called upon. The other thing I thought was interesting when I first came on the board was somebody asked me one time, we were talking about ways to save money, and they made the comment that, well, if you just close that building out there on Morganton Boulevard, and I was like, okay, what building are they talking about closing down? And then finally it realized they were talking about the Health and DSS Board and, you know, all the free things that society thinks that we give away, right? There's very little that we give away in the scheme of things when you look at it. And I was the guy who said, well, we probably can't close it down, but maybe there's a way for us to go out there and make some cuts and save some money. But it didn't take me long to realize that some of the hardest working people in this county, in this government, are in that building. If you ever go by that building at 6, 7, 8 o'clock at night, chances are you're going to see the lights on. There's more people doing work in that building than there is in any other agency and we have in this county. It's humbling to see what you guys do and to understand what you do. People don't know what you do. And it's moments like this, Appreciation Month, that allows us to show you some appreciation and try to help the public understand what it is you do and why you do it. And to me, it's an honor to be a part of this team from a board member standpoint, because I do see the effort y'all put in every day. One quick story, I was having a conversation the other day, I'm not going to mention any names, and one of their reasons for not wanting to go visit somebody was, well, we're a little afraid of our safety. We have to be careful. We go into these homes, we have to be careful because we don't want to put our employee at risk. And I said, well, social worker don't seem to have a problem with that. So why would you? I said, a social worker rolls up at somebody's house at 8, 10 o'clock, 3 o'clock in the morning knocking on the door. Why would you have a problem with it? And immediately their whole opinion changed because they realized, wait a minute, I'm probably just making an excuse here for not wanting to do it. So I have seen you in action. I know what you do, and I greatly appreciate each and every one of you very much.
As a fellow social worker, I want to just jump in for a minute and piggyback on what Donnie said and really show our appreciation for you guys. But Crystal mentioned as well appreciation for all of your families who allow you all to come to work every day, and they sit at home and warm dinners when you don't make it there, and your children who sometimes have to get to events with other parents because you're out in the field doing the things that are necessary. So thank you very much, and thank them as well.
Absolutely. A lot of sacrifices that y'all guys put in now.
Yep.
Anybody else? Jarrell, anything to say?
Thank you guys. Social work's amazing. Graduated and still working as a nurse when I left college, and I wasn't knowledgeable of what social work did until I started working in the hospital, and I actually was talking about social work. Earlier today, we have a very skilled social worker that works in our behavioral health area, and she's awesome. And I was just singing her praises, and I said, I didn't really realize all the things that she does until I sort of dug a little deeper, and without her, the hospital would probably drown. So I'm so grateful for you guys. So grateful.
Yeah, it's interesting when people can't figure things out, when there's a plan to be made, social workers are going to be the ones to figure it out. there's that, it just, we've just become so adept at that. You know, we just have to, there's so many things thrown at social workers all day long, and you just become adept at, okay, we're gonna problem solve this, we're gonna prioritize this. And our staff do a really good job with that. And so it's an honor to have
Yeah.
these folks.
I've said in the past, behind every good man's a great woman, but behind every government agency is a great social worker. Because to Kim's point, it does get dumped on you quite a bit. You do a lot of things that technically aren't your job, you know. Krista was talking about the social worker who drove the kids, you know, to a rehab facility 5 hours away. She gave some great examples of what your job requires you to do, but she also gave some examples of what your heart said was the right thing to do. And that's the part that, the job part's easy to understand, right? Because it's all written down somewhere. This is what you're supposed to do. It's the other stuff that's always hard to understand and explain because it's not. It's coming from the heart. So, again, we appreciate what you do. Thank you so much. And the ones who are not here tonight, make sure you share our appreciation with them. Thank you. Diane, do you have anything? Okay. Catherine, y'all good? All right. With that being said, we'll move on to Celebration of Life, Miss Beverly Rupert, Adult Supervisor, with April Williamson, Adult Supervisor. Got the whole crowd.
kind of a
Y'all don't
hard
have to
act to
leave.
follow.
We just gave you all these accolades. You get up and leave on us.
Go home to your family.
I'm just kidding.
They're probably going to do work.
Okay, I just want to give a quick update. Celebration of Life is planned for May 17th, and it's going to be at Mountain Grove Church again. We have the same caterers last year, same entertainment as last year. We're going to be working on a few other things, but our main issue right now is raising funds. You know, this is all a community celebration of our senior citizens, and it takes a lot of money to get it going. Last year, I think it was around $8,500 is what it costs. You know, it's not in the county budget or anything like that. It's strictly off of donations and fundraising. Well, I will tell you this, we already have 15 booths, which to me that's pretty good. We average about 20, which we'll have more. But right now, we've already got 15 booths. We've had 2 gold sponsors, that's $500 or more, which was Brockford Inn and Via. They will get full publicity. They'll get their logos on the back of our T-shirts, anybody that's a gold sponsor. And then we also have Lenore Healthcare, Premier Home Care, and Caldwell Home Services. They are all silver donors, which is a $250 donation. We are doing an auction at the agency on April 30th. We've got tickets from like Grandfather Mountain, Tweetsy, and we will let everybody auction on those, silent auction. We are doing our lunch buddies again. It's our lunch buddy. And these are $8. And what that does is that pays for the meal for one person. And if you're on the county insurance, and you're interested in Pulse Bucks, if you buy one of these, you get 20 Pulse Bucks to go towards your, the wellness program. And we are selling T-shirts again for volunteers or anybody who would like one. They'll be black with the gold, Stay Golden, Celebration of Life logo, and then the gold sponsors on the back. Is there anything I'm missing here?
Talk to us a little bit about, you've got the booths, 15, I guess, vendors. What is that? What type of vendors are you wanting in that or needing
We
there?
have anything that would be for an older person, a senior citizen. We have Yoke Fellows coming, the Senior Center is coming, Veterans Affairs, the Library, Services for the Blind, Geriatric Specialty Team through VIA and PACE, and then also Lenore Healthcare will set up a booth, some of the local facilities, some of the Medicaid, what's that word called? Medicaid entities like Blue Cross Blue Shield, they'll set up a booth. And then other agencies like Total Home Care, they offer equipment to seniors, like canes and rollators and stuff like that. Anything that would be to interest, Restart Community Paramedics, they're setting up booths. And, so,
Any service that an elderly would need from the age of, actually from the age of 18 going forward up to death will be there, hopefully will be there. You know, because we are seeing a lot more younger folks in facilities, so we'll have all of our facilities there, explaining what they do in the facilities, what kind of programs they have. We also have all of your home care facilities, managements, that do the block grant, for private aids, that type of thing, we'll have there. And they give out, prizes. Normally it's Brookdale that brings the bags, and they all line up, and they just go down the line, and they
cups
get
and
all of their,
pins and, you know.
information and all their free little gifts all the way through. So, I mean, it's just information that they would need all the way to death.
The hospital got anything?
I have
real.
reached out to UNC.
I was just about to
Healthcare,
ask.
yes,
That's the
I
man
have reached
right
out
there.
to them, and I just got a second email. They're trying to, I think they are wanting to do a booth on stroke education, is what I'm thinking.
Yes, it's good.
Okay.
It's good.
And also,
I'll get your contact later on, just make sure there's some follow through from that standpoint.
okay. And then also Fry Hospital's reached out to us also.
RHA?
Yeah.
Okay.
I thought I had emailed you actually, but
Had you?
maybe
Okay.
that was Crystal I emailed about the other thing.
Okay.
So I
I
might have
can-
gotten my events confused.
Yeah.
I can think that prevention folks, with
Yeah.
lock boxes and med boxes and those sorts of
That's
things
what I
will be
was
really
thinking.
helpful.
Yep.
And then we
Yeah.
can do some, other resources.
And Restart will be there, of course, and
Yeah.
community paramedics will be there also.
Think about, is there any local businesses that could?
Well,
like
a lot of times with the
banking, like I
local
could-
businesses,
One of the things I thought about was banking, right? So a lot of senior citizens are,
Estate planning. and-
yeah, estate planning and that type of thing. So it's kind of where I was
okay,
thinking
That's
from around the banking side.
idea.
We do have several of the local lawyers, Clark and Clark,
Yeah.
Penny Hamby.
We
They,
sent out to
Wheels and-
them.
Yep,
yep, but Clark and Clark, I know that they have switched mainly to doing elder law as well as estate law. So
That's
they'll
good.
come out.
good one. Yep.
And then Penny Hamby, she also does a lot of our guardian estates, so she can.
Yep.
Letters have all been sent out. We've got 15 confirmations back
Yeah.
in. And the way we, because there's no budget for this,
Right.
if you want to do a booth, it's $50 for a booth. And you get advertisement there, and then at $250, 50 is the bronze and $250 is the silver, and then the gold's $500. Where the gold, you get full publicity, radio, T-shirts, the TV show, you will have a publicity all on the tables. We have little cards we put on the tables for the gold sponsors. Then the silver sponsors, theirs is a little less, and then the bronze is the free booth and the recognition. So there are benefits to the more you donate.
Could you send me those sponsorship options as well, whenever we communicate in email?
Yeah, I've already sent it to her, but I will.
Okay.
I will. Send it to you too.
Yeah, I was
don't worry.
thinking about, because what's the age group?
60 and older.
I kind of thought I might be in that group. I was sitting here thinking through my mind.
Well, we
you know,
kind of
what
expect
would
you
I
there
like to have?
anyway.
Well, unfortunately, I will be on a cruise that week, so I'm gonna have to miss it this year, unfortunately.
It's going to be good each year. It just gets better
May,
and
what'd
better.
you say, May?
17.
Wait a minute, I might be, because we
That's
don't
a
leave till,
Friday.
we don't leave till, I think the cruise leaves on the 18th. So I may can work that out. What time is it? It's in the morning, isn't it?
It
Yeah,
starts at 8:30, doors open 8, and usually it's over by 12:30.
yeah, yeah.
The
Who's doing the catering this year?
Timberwoods, the same,
Okay, yeah,
they
same
give
one.
us the best
Yeah.
quote.
Yep.
They were very good last year.
How about Blue Ridge Community Actions? Have you guys talked to them?
I probably have sent it out. I've
Yeah.
not heard back.
Okay.
There's several I haven't heard back yet.
All right.
Now, if it's a nonprofit, they do not have to pay for a booth.
Right.
But a lot of times, the nonprofits will volunteer to help us, because the booths run from 8:30 to 10:30. And a lot of times, the nonprofits will help us serve the meals and stuff like that.
Do
to
you
help
need
us.
volunteers?
We always need
Okay,
volunteers.
all right.
If you
People
want-
listening at home is the reason I'm asking, so.
If you have any volunteers, information, April is in charge of volunteers.
Yes.
Just reach out to April.
Okay. I will do that. I've got somebody in my mind, so he's asked to get involved in the community, wants to do some volunteer work, so I'll.
And we
mention it to him.
usually, we try to also, the Communities in Schools program,
Yep,
we always reach out to them because we like to have those kids come. And also, we had some kids who needed beta club hours one day that they came. But
great.
it depends on if the school's willing to allow them to excuse.
yeah, that's a
But
good one.
we found that the people attending love to see the kids there.
Oh, yeah.
That's why the entertainment will be Bob Henson again, because
That's
they
good.
love to see the kids.
Yeah,
So,
And then, last year was our first year of getting, the high schools, they, do horticulture, so they do the plants.
Oh,
and
They
stuff.
helped with
So
our
a
plants
lot of
so
last
our
year.
I remember the plants being there last year,
Yeah.
yeah.
Yes, a lot of the plants came from the local hospitals.
and Sharon with Yokefellow helps coordinate that.
Yeah,
So
I
we
remember
tried
the
to,
plants.
I was there last year, and I know a lot of the participants were going around looking at the different plants on their table and trying to decide which ones they wanted and what they could do with them. It was really good last year. I thoroughly enjoyed it, and I plan to be there this year too.
And speaking of businesses, a lot of businesses donate door prizes for us. You know, they may
Yep.
not do a booth, but they'll donate a door prize.
Yep,
That's a
okay.
big thing, because, you know, we have a ton of door prizes. They get a number when they come in the door, and we pick the numbers, you know. So that's a
Okay.
good thing.
Anybody else?
And if you have any questions, just, you can email April or
Yeah.
I.
Sounds good. Well, thank you so much. Appreciate you putting all this together. And I know it takes a lot of work.
It does, it is worth it.
It is. It's a lot of fun. It's a great event. How many do we anticipate coming? I know
Well,
it's
you know,
been big
before
in the past and COVID sort
Yeah,
of.
before COVID, we'd have 400.
Yeah.
Last year, we had 241, I think, but I figure each year, we're gonna
I
get
think
a
it's
little
gonna be
more,
a
so
little
we're
better.
planning
Yeah.
for a little more than that.
so
Yeah.
this year, I plan to send out to most churches our flyer, because they like to come in church vans, as a groups and stuff, so I wanna, really advertise us this year to see if we can get better,
Churches.
turnout.
That's great. Yeah. All
And I've
right.
actually, is it the Silver Sneakers? Silver Sneakers?
yeah.
They have already reached out to me because they wanted to reserve,
That's
so.
great.
So we're
Yeah.
going to, if you have a
Okay.
group that wants to come, and you let us know the number of people, we can reserve a table.
Are they gonna do some exercises to show everybody what they do?
They didn't, but hey, that might be an
That would be a
idea.
good idea.
Yeah.
That
I
would
mean,
be a
'cause it'd
good
be
idea.
fun. Yeah.
Okay, I'll reach back
Yeah.
out to them. I didn't think about that, but
Yeah.
yes. But if
Yeah.
you do have a group and you want to come, we can reserve a table. That way, you're guaranteed to sit together.
That's awesome. Yeah.
That's
All right. Sounds good.
Thank you.
Thank y'all.
All right, next on our agenda, we'll move along, is monthly updates, and the first one's gonna be the most exciting one that ever shows up, is Chris Connolly, our financial report. Just comes with so much excitement and information.
And just to make it official, I do not pay him for the free advertisement. But thank you as always, Donnie. Our monthly report for February, reimbursements totaled $987,057. We ended the month with receivables at right at 1 million. To the far right of that number, expenses for the month totaled $1,254,291. Therefore, our county dollar expensed in the month was $267,234. In our year-to-date comparison to prior year, expenses are up $410,000. Revenues are up 348, almost 349,000. So our county dollar is only up almost 62,000 at this point in the year, which is likely more surprising to me than it might be to anyone else, just because of things we've done during the year, some increased expenses compared to last year. So I'm very pleased to see that number and, hope we end somewhere around 100,000, but that's far under what I thought we would end at when I did the mid-year review back in January. So, but again, pleasant to see it at this time. We'll see what we look like in August when the year closes out.
Well, you guys are always great stewards of the taxpayers' dollars, so it's greatly appreciated.
Thank you. We try to be.
To be at 61,571, that's a pretty good number. So
Right.
we can come in under 100, I'll be tickled to death.
I'll
Considering
be-
what we thought we were
I'll
gonna
be real surprised.
Yeah,
But, hey, I mean,
You
that's,
might even
that's the track
you
we're
might
on
even
right
get it
now.
below that 61 if you tried real hard, Chris. Just keep in mind.
I'll
No,
be,
but you guys, you do an awesome job, Chris, and helping us manage all that, because there's a whole lot of, most people don't understand how much money's flowing through, in and out of DSS on a daily basis. It's a lot of money.
yeah,
So you do a great job of helping us manage all that,
thank you. Thank
as
you.
always.
I'll be happy to answer any questions.
Any questions? All right, we'll move along. Thank you, Chris.
Thank you.
Director's report, Ms. Kim Arnett, Director.
So I'll start with talking about our personnel report. As you can see, we are down in the single digits with our vacancies. So we're very pleased about that. We are hopeful that we can get to 0 vacancies. That's our goal. We will continue to hope for that and work toward that.
Have we ever been at 0?
Not since I've been there.
I don't
And that's
ever
been
remember.
since 2011, so we'll
So
see.
if you get these positions filled and somebody tries to quit, just hog time
Well,
long enough.
you said we're not accepting resignations till
Right,
August
just-
1st, so,
Yeah.
sorry, no
Yeah.
one can quit. till
Can't
August
leave.
1st. At least August
Yeah.
1st, I think someone said August this morning, so yeah.
Yeah,
But we've seen a really significant uptick in our applications received, and that's because of our advertising on Indeed. We had 85 applications through Indeed. And so I haven't compared what we've received on Indeed versus what we received through the county website, which I need to do, but it's significantly more. And so we've had a lot of
And are they
luck with that.
promising ones, like, I mean, qualified and, okay.
Yes.
That's good,
Yeah. We've hired several of those applicants.
awesome,
So yeah, we've been very pleased.
that's good.
I know that the county's working on a corporate account with Indeed to start advertising through the county, because it is a little cumbersome for us to do it separately, because we have to respond to the inquiry. They send a resume, and we have to respond to that, and Lori's taken that on, and she just sends a message to them and says, please go to the county website and apply here. So
Okay.
it's,
Yeah.
because we can't link that with a free
Without
account
an
on
account.
Indeed.
Okay,
would you mind
So-
following up on that tomorrow? That should have already been done.
Yep, I
mean,
will check on that.
We've had a month to create that account, so
Yeah,
you
I'll
might
check
have
on
to
that.
light a little fire somewhere.
I think, I
get
mean, I
that
do
done.
think they're working on it. I don't know where it stands, but I'll find out
Yeah.
where they are
Just
in that
be good to
process.
get a follow-up on it.
Yes, I will certainly do
Keep it
that.
in the front of their basket.
Yeah,
Because the basket gets full, and the more gets put on the basket, things make it to the bottom. So from time to time, you got
I
to pull yours
certainly-
out and put it back on
I
top.
certainly understand that.
Top of the stack.
But we're doing really well. I think if I am correct, I think we've completely filled our Medicaid expansion team now. So
Great.
all of our positions, now we had some filled, and then we stopped hiring in that area and started hiring and focusing on another area, but now we've been able to completely fill that team, so we're very excited about that. And have some people, other applicants that are promising prospects, so we're looking at
Good.
continuing to hire diligently. And I'll say our staff development folks, Crystal and Chastity they've just been warriors, I'm telling you, with all these interviews, and it's a lot, not to mention on top of everything they have to do in addition to interviewing. That's just another thing that we've added on. And I don't know that there's been 1 month, or I don't even know if there's been a week that they haven't conducted an interview. And so it's a lot. So we're hoping that we're able to slow that down and then focus on some other training needs and things like that, so. In March, we have done a lot of employee appreciation activities. Our employee recognition committee had put together some really fun activities for March. We had a Spirit Week in March where we had, one day was tie-dye day, one day was superhero day, wear your superhero t-shirts. One day was wear your favorite, athletic jersey. We also had a chili cook-off. We also had a hat day. I was very impressed with the participation in our chili cook-off. I think that's the biggest one we've had in a long time, and some really good food, honestly. Too much to actually taste it all, so, but it was a lot of fun. I think that everyone enjoyed that. We also had our first information session, and that went really well. We had about 35, did you say, 35 people that came to that? I know Donald, our county manager, came and sat in on that. Some other people from HR came and sat in on that. We had people from the hospital. We had someone from the schools. We had people from other community agencies come. And so I think that was a success. And I got some positive feedback about it. And so we will be doing that again. We're going to do it quarterly. So June is our next one, first week of June. And so we've already sent out an email about it to all the people who participated, and to, so that if they have new employees to send them, or some people who didn't get to come, maybe they want to come. So that went really well. We have our resource fair coming up for our county employees. So it's for all county employees at the library on April the 3rd. I think we now have 51 vendors set up. So, the vendors are set up to advertise resources for individuals and families in the community, so that people in the county can see what is available. Maybe that it's available to help folks that they're working with, or maybe they need that assistance. And so everybody is invited to come, and I hope we have a really good turnout with that.
How are we getting the word out to that?
We have sent out emails, we've talked about it, I've talked about it at department heads meeting, we've sent out multiple emails with flyers, and so, yeah, we've hopefully gotten the word out sufficiently. Also want to talk real quickly about a survey that we sent out. I did a employee satisfaction or employment engagement and satisfaction survey as part of our employee recognition committee. We talked about sending this survey out to our staff to see what it is that they felt like we were doing well, trying to keep it positive so that we could look at it to see, okay, what are the things that we really need to keep doing, and what are the things we can take from this to work harder on. And so sent it out the first time. We have 176 employees. We got 33 responses. So I sent it out again. Well, I sent an email out and said, please, we need more responses. We really want to hear from you. And so sent it out again, and now we are at 75, I think is the last time I looked. And so it closed on Monday. So as the recognition committee, we're going to be sitting down and looking through some of those answers. I'll present some of those to you all. It is an anonymous survey, but they did have the option to put their name if they wanted to talk more about their answers. And so there are a couple people who put their name, and so I'm going to be meeting with them individually to hear their feedback. But they had a lot to say about the activities that we have been doing through the recognition committee. A lot of positive feedback about those things. So I was happy to see that.
Good. Anybody got any questions? All right, thank you, Kim. Next on the agenda is Child Services and Adult Highlights. Laura Harrison, Child Welfare Program Administrator.
Good evening.
Good evening.
So, as you see, it's displayed for everybody, and everybody at home can see the numbers as well. So I'll start with Children's Services. And before I start, I'll let you know that I also looked at last year at the same month just to compare as well. It's very comparable to this month's, or for February of this year. So just so you know that as well. So in intake, we had 195 calls that came through. We had 69 reports that came in that were screened in for us to assess, 24 assists, that was from other counties within the state that asked us for help. Our in-home services, we had 20 total cases, families that we're working with, and 6 assists that were from, again, throughout the state, other counties asking for assistance. In foster care, you'll see our number did go up just slightly to 161, and I'm gonna back up to in-home services. You see there was quite a big jump in those. In February, our in-home team got hit pretty hard. I hate to say it that way, but we saw a lot of cases go that needed our service to longer than just those 45 days. They needed some more assistance from us. The foster care 18 to 21 remained the same at 7 young adults in that program. Adoptions, we were able to finalize 1 adoption in the month of February, and the 22 licensed foster homes and 7 that are relative kinship. And so some highlights that I'd like to talk about. We recently went through a state audit for Children and Family Services review. It's a CFSR. I talked a little bit about this last month. We had that review and had a debrief with the state, and we did really well in that. Had glowing not recommendations, but glowing reports back of what we did. Our worker that worked on that case did a fantastic job engaging the family and other providers as far as foster care, the Guardian Ad Litems program, and things like that. And so that reviewer comes in and not only looks at documentation in the file, but they make phone calls and have these interviews, also in-person interviews with those folks, like social workers, with the placement providers, or foster care homes. There was a grandfather that they talked to the mother in this case as well. And so got great feedback from all of those, and just really highlights, like we talked about earlier, all that great work that our social workers are doing. So we were really happy to see that happen. We're currently in another state audit that's looking at 3 different programs, which is MAC, Medicaid, which is Medicaid is something claim, I can't remember. Administration claim. So I think there was 4 or 5 cases pulled for that audit. GAP, which is the Guardianship Assistance Program, and that's for anybody that a family takes guardianship over of a child, and they meet certain criteria of age and things like that. So they're looking at that, and there was 1 pulled for that. And then our state, it's federal $40, an audit for that as well. And so when these audits happen, it's not just simply, here's a file. Like, we sit down and prepare those files. We go through them to ensure that everything's in there that we need before they come in and to review that. So just want to highlight that we're currently going through all that too, as well as preparing for a federal CFSR. And we're hopeful it will turn out just like the one we just went through for the state, that it will be just as good. And we really don't have any concerns as far as we can tell. Again, we're internally reviewing that. And that file that was pulled, that case, is 5 years. And so that's a huge file that we have to go through and make sure everything that they're asking for is in that file.
Yeah, and I'll just add, we don't get to pick that case.
Yeah.
They tell us, they just randomly pull and tell us what case. So, we can't say, oh, what's a good one to pull?
Sure.
As much as we would like to do that, we can't. We have to pull whatever case that they have chosen. And so, we did. I sat in on that debrief, and they had some very good feedback for our social worker.
Yeah, she did really good work.
Yeah.
We're also preparing for a federal e-audit. That's money that we pull down. Those will be, we don't know those files or those cases, just like Kim was saying. They'll let us know hopefully soon which one of those cases are pulled so we can prepare and get those together. So there's a lot of those going on right now. I want to highlight, we did the Leprechaun Leap race that the city of Lenore hosted. And so I know we saw Diane there. I think Tracy may have been there. No? Okay. Sorry, I heard somebody say that you were there. But Diane was there, and she saw us. We had our Be the Village T-shirts on. We were able to get those made, and with our Empowering Social Worker logo on the front as well. We had one, he left earlier, social worker. He did really well. He ran it. Our attorney, Austin, one of our attorneys, he was in it and finished well ahead of a lot of us that.
He also ran. We did not run.
No, we had somebody from accounting, Rebecca. She participated, and she also ran. Several of us, though, walked together.
Well, we
did not
wanted to
run.
stay as a team, you
Yeah.
know, it
Yeah.
was like, well, everyone's
Yeah.
not running, so we're just all
Okay.
gonna walk.
I'll
That's
buy
what,
that.
that's what we're sticking to. That's our
Yeah,
story.
That's your story, you're sticking to it.
Hey,
I
at least
got
they
it.
did it.
We did.
That's the main.
We also had a
finished it.
tent, or I don't want to call it a tent, but set up that had snacks and water for the participants. That was Be the Village as well, so we were able to get out and get our name out in the community. So that was really fun. I think all of us that did participate had a lot of fun in doing that, and we hope to continue to do more activities in the community as the year progresses. And then the last thing I want to update on is that we had 30 suitcases donated from Vera L. Holt Area Women's Missionary Society, and that's for our children that come into care. That way they don't have to use trash bags for their belongings. They do not deserve that, and they deserve to have something that is not that. So we were very thankful for that donation, to be able to use that for that. And then I'll go over the adult service numbers real quick. And again, I did the same thing when I went back. It's not on your paper, but I did look back in February of 2023, and it's very comparable to the numbers that you see here. We had 50 adults that we had guardianship of. We had 40 reports or calls that came in through intake, and then we had 27 that we screened in to assess. And I don't have any highlights for them because we had earlier the celebration of life presentation. But any questions about any of that?
Just a random question, but when you get donations like that, where do you store that? I mean, that's a lot of suitcases, so where do you put those?
Well, that's been a struggle.
That has been a struggle. We do have a closet. We call it the clothing closet. We have an office that is turned into the overflow of the clothing closet.
Okay.
And then we also do have a small storage, I don't know what to call that, a storage
Unit.
Unit, thank you.
Okay.
At the old mall.
Yeah,
That we do
yeah.
pay for to help store. But normally the stuff that is stored there is items that belong to children that are already in our care, and they're in a place that they can't take all their stuff, and so we have to have somewhere to store that.
Actually, Caldwell People pays.
They
for
do.
it. Yeah. Chris said that.
Sorry, Chris.
He's like, no, we don't pay for that.
Yeah, Caldwell People
He
actually.
quick stood up quick.
Don't get me in trouble.
That's the dollar picture right there. Yeah, you got
We
it.
do not pay for that, sorry. Caldwell People pays for that, yes.
Yeah,
So, is there not the unfinished
there is.
portion of
And
the building that you can use?
that area, there's a lot of, I think some of the folks in planning may actually use that area
They
for
do.
like somewhat of a makeshift conference room.
okay.
But that is only one section of it. It's a fairly large unfinished room. But there's a lot of furniture and extra chairs, and so it just gets really filled up.
So
with
does it need to be
things.
cleaned out? I mean, is it
We've
stuff
cleaned
that?
it out in the past, and we actually were just talking about that the other day.
There may be some cleaning out done in it tomorrow, as a
Yeah.
matter of fact.
I was gonna say, I would get with Jimmy and maintenance or Donald and see what,
Yeah.
because I mean, we need space over there. It's just, if there's just stuff in there that we're not using, it needs to be moved,
Yeah.
you know?
And so we, I think we also, I know Casey's been working hard on getting some stuff moved around on the second floor because we have some rooms that we used as file rooms. And now we've scanned a lot of things, and so we no longer need those paper files. And so we are shifting some things around on the second floor to try to make some room, so.
Yeah. Anything else? Thank you.
How'd you know you was gonna be next?
I just
I ain't even
knew.
called your
Lucky
name.
guess.
She can read.
Family Support Services highlights, Miss Brandy Hood.
Good evening, everyone.
Good evening.
So to go over our February numbers, for food nutrition, we completed 411 applications, serving 11,823 individuals, totaling $1,943,508. For our child care services, we completed 29 applications, serving 684 individuals, totaling $260,121. For Medicaid services, there were 688 applications took, and 26,101 individuals currently receiving. For our Work First Family Assistance, there was 10 applications submitted and 28 current individuals on that program. For our child support services, we have 2,649 active cases, and the total services paid out was $418,681.35. And if you see that big jump there, that's gonna be, you're gonna see some tax interception and things like that. So during this time, it normally jumps pretty high. For our emergency assistance area, there was 789 applications completed and 404 telephone calls requesting services, with a total paid out of $197,712.92. For our customer service department, there was 2,140 individuals assisted at the front desk, and 4,486 phone calls come through the agency. I just have a couple things to go over. We, like Laura had mentioned, we are currently going through a couple audits as well. We're going through another Medicaid audit. It's a series of cases that's pulled once a quarter. And what it is just to verify that we're following the correct procedures when going through the unwinding period. And what that means is now that the COVID waivers have been lifted, they're making sure we're following regular protocol now. So they're pulling approximately 7 cases per quarter, making sure all the forms are correct and the actions that's done against those cases are correct. In the month of April, we will be going through our management and evaluation audit for our food and nutrition, emergency assistance, and program integrity areas. They pull at least 20 cases per program, and if even one thing is wrong on the case, the whole case is in error, so we'll have to redo it in 6 months. They keep coming back until we get them completely correct. So we're preparing for that. Our staff development area has been working really hard, not only with interviewing, but also going over these cases and making sure everything's where it needs to be in our system to make sure it's easy for the auditors to find. And then one last thing I want to mention, next month I'm gonna have some more exact numbers for our emergency assistant peak season numbers. We're trying to finish up all of the applications for the month of March, but as of from November 1st to February 29th for our emergency assistance area, that was what we consider as peak season. That's when we normally get the most applications. There was 2,761 applications completed in that area. So I just wanted to highlight that and those staff members for completing those applications. Any questions?
Anybody got any questions? All right.
All right, thank you.
Brandy, we appreciate you as always. Anybody else got anything before we move on to the next item, which will be our next meeting will be on April the 30th at 5 p.m. here in the same location out in the Starnes building. So if you'd like to join us, please do so. With that being said, I will entertain a motion to adjourn.
I'll make the motion.
Second.
Have a motion and a second. All in favor, please say aye. Aye. All opposed. Motion carries. We are adjourned. Thank you for joining us this evening.